I'm at Moffitt Cancer Center with Dr. Frederick Locke, one of the few oncologists in the nation researching next generation treatments for patients with aggressive blood cancers. Dr. Locke, what a pleasure it is to meet you.
Hi, Gail. It's a pleasure to be here and be speaking with you.
So tell me a little bit about your research.
Well, I treat patients with lymphoma and multiple myeloma, and we use an exciting new gene therapy. It's a cell therapy where generally we take a patient's own cells, T cells, that help fight infection. We take them out of their blood, and then we reprogram them to recognize a protein on the surface of their lymphoma or their multiple myeloma. And once they're reprogrammed, we grow them up and we infuse them back into the patient's vein where they circulate, they know where to go, what to do, and they hopefully get rid of that tumor for good.
That's incredible. So this is CAR T therapy we're talking about.
It's called CAR T therapy or CAR T cell therapy, which stands for chimeric antigen receptor T cell therapy. And really that's just the name of the gene that we insert to reprogram those cells. Again, they know where to go and what to do to fight against the lymphoma or the myeloma.
That's incredible. So talk to me about like traditional treatments and some of the roadblocks you face as a doctor without this kind of therapy.
Yeah, so traditionally we would treat these cancers with chemotherapy. And unfortunately for those patients whose disease progresses, really the options were pretty slim. More chemotherapy or even stem cell transplantation. But now with CAR T cell therapy, we're able to get a larger number of patients into remission, and many of those remissions are durable for many years.
Now, how does off-the-shelf allogeneic play into all of this?
What we primarily do is what we call autologous CAR T cell therapy, where we take a patient's own T cells out. But unfortunately, a patient with cancer has T cells and immune cells that can become exhausted. Also, we're giving chemotherapy or other therapies to those patients before they get to CAR T, and that can cause damage to the T cells. One of the things we're researching is the use of allogeneic CAR T cells. Allogeneic quite simply means from a donor. So a healthy donor without any medical problems, who we take the T cells from that person, and then by using those healthy T cells, we can have the CAR T cells ready to go, sort of off the shelf if needed, to give to our patients, currently on clinical trials, but we hope it could become a standard treatment.
That is so amazing. How did you get into this? Where did this interest come from, doctor?
Like many of us in the cancer research field, I had a personal experience. My father had lymphoma, and traditional chemotherapies weren't working, and we were able to locate a clinical trial for him, and it was an immunotherapy, and it worked well, and he's alive today, decades later, because of trying something new and different. And so then when CAR T cell therapy came out in clinical trials, it was natural that I gravitated towards that and was interested to try to use that for our patients. Fortunately, it's really worked well for many of our patients.
Well, your father and my mother had something very much in common. It was a doctor like you, so forward thinking, that gave my mom more years in life. So it's incredible what you're doing. And I know you're part of CAR T Together with other physicians. What's that all about? Yeah,
so with CAR T Together, a number of us who give CAR T cell therapy, we're really interested to shorten the time it takes to give patients this amazing treatment. And so we're focused on the allogeneic off-the-shelf CAR T because we can give them to our patients right away. And so by banding together, highlighting the clinical trials in this space, we really hope to reach more patients.
Doctor, it's so exciting that you're here right in our own backyard offering this. I'm sure people all across the country will be excited to know that this is happening right here in Tampa Bay. So thank you for sharing it with our Bloom viewers today.
Thanks, Gail. Thanks for having me, and I enjoyed our conversation.